the key panels on healthcare reform in Washington, D.C. actually doesn't have very many, if any, practicing physicians. Our healthcare advisory panel has a number of practicing physicians. We do not toe the Republican or Democratic line. We're trying to toe the medical line to make sure that a couple of key principles are preserved in this debate. Number one, do no harm. And so that if you have good Medicare or good employer-provided care, if you're one of the 170 million, I don't want you to be dropped, and I don't want you to be harmed. Secondly, to make the kind of reforms lower cost, demonstrated actually in the states to have already succeeded. And lastly, then, to preserve the quality of care, especially when you look at cancer survival rates across Europe and socialized medicine countries and in the United States. Bottom line, you are far more likely to survive cancer in the United States than in other countries. If we lowered the quality of care and had the government control, then where would we drive? And so I want to make sure that we especially adhere to that key principle. The floor is open. We can talk about anything, healthcare, Iran, Afghanistan. Sir, go ahead.
Thank you, Congressman Kirk. First of all, I just want to make a quick statement that I find it hard, based on what we've heard, that the interests of the trial lawyers seem to exceed the interests of the people, and that really kind of terribly upsets me. My question, I'm going to do one because of time, and that is, do the members of Congress live by the same rules we do? In other words, when these bills do pass, no matter what they are, do you have to live by those same rules that we who elect you have to live by?
Yeah, I would just say that if we have the poor judgment to create a public option, we should have the good judgment to force every member of Congress in it.
Thanks, Mark. The words illegal and jail and fine should not be in a health care bill in the United States of America.
You're referring to the penalties and taxes?
Yes, sir.
Yeah. I was struck by how one of the taxes in the bill, in a recent interview, I think it was the president with George Stephanopoulos, said it's not a tax, and George Stephanopoulos read the definition of a tax, which is a fee imposed by an authority for a public purpose. And then when you reach page 29 of the Baucus bill, that exact provision says this is an excise tax imposed on the American people. And I worry about that very good. Sir, in the back.
Thank you. Good morning, Congressman. I wanted to comment on two recently introduced bills. One Pat Leahy introduced last week, a bill to lift the exemption on insurance companies from the antitrust laws that go back to 1945. And I believe yesterday Senator Dorgan introduced a bill to allow re-importation of pharmaceuticals from Canada and elsewhere across our borders. And my question really is, can we have your comment upon these two subject areas? Not necessarily the bills, but just the two subject areas.
Yeah, I am for lifting the exemption because I think we should have rock and roll in competition in the insurance And I worry about re-importation right now because did you all see the heparin scare from China that came into the United States? One of the good federal programs that I think is out there, I think, correct me if I'm wrong, created by Theodore Roosevelt, is the Food and Drug Administration, which ensures that every drug offered for sale in the United States of America, number one, be efficacious, meaning it does some good, and number two, be safe. That legislation does not cover drugs produced in other countries, and I want to make sure that when you go to Walgreens or any other drugstore, everything on the shelf is as safe as possible. Hold on 1 second so everybody can hear.
How are you going to get insurance companies to be competitive when there is not going to be a plan that they have to compete against, such as a public option?
Well, first of all, I would say that, as you heard prior, we should not have antitrust exemptions for insurance companies. Secondly, in many of the medium and smaller states, one insurance provider has a dominant share of the market. And the moment you get monopolies, you get high prices, waste, and efficiency. Of course, the government being the ultimate monopoly, where the high price, waste, and efficiency is the greatest. We have found, by the way, I hate to say this in the middle of a public debate here, but you almost have to these days. I am a capitalist. I am for capitalism. That's why I think you have a right as an American citizen to buy coverage from any state in the union. Probably the best example of competition in the medical field is we were told when we created the prescription drug benefit for Medicare that it would cost $634 billion over 10 years. A number of people said, you cannot allow competition. This must be a government-only prescription drug program. And I'm sure that if it had been a government-only one-stop shop program, it would have cost taxpayers $634 billion. But now we learn, because of rock and roll and competition between providers in the Medicare Part D system, the cost is now down to $395 billion. That's what competition does. Better services.
Thank you. Can you please explain to us why we cannot buy insurance across state lines? Whose interest does that serve?
It serves insurance companies that have, by the way, you're beginning to pick up a theme here. I do not hold a brief for the insurance companies here. I think we should wipe out the pre-existing condition rule. Providers have these sweetheart arrangements in medium and smaller states where they dominate the market, and the market is controlled by the state insurance regulator. And I think we should have a national competition for insurance, so you have big, large insurance pools, and the people that are offering the best coverage at the lowest price win. That's how
Thank you for having us. I'm from Melissa's Beams area, but I couldn't go to a meeting, so I heard about this. I'm a prostate cancer survivor, and I came down with it 10 years ago, and I want to support your comment that we in America are survivors, and I was treated aggressively, and I met a gentleman playing golf in Florida who was from Canada, and his PSA was like around 7, which is high. I said, what are they doing for you? He says, well, they told me 7 months later to come on back and they'll take another look at it. So that proves that they're not interested, if you're over 65, to have you live. Here in America, we do want our 65-year-old people to live. Thank you.
I brought an extra chart.